Bismillahirrahmanirrahim. This video is about the topic of miscarriages, and we will explain and discuss few FCPS Part 2 questions related to the topic of miscarriages. We had one question in the previous exam about the risk of miscarriages at the age of 30 and 35 years. Okay, and different options were given like 12%, 15%, 25%. Basically, you have to go to the guideline of recurrent miscarriages and try to find out the answer related to this question. Okay, and not only you have to memorize the risk of miscarriage at the age 30 and 35 years, but it would be better if you find the other risks related to the other age groups as well, this one. Okay, point 4 of the guideline of the recurrent miscarriages. When we check the epidemiological factor, we can find the answer of these questions. You can see from the arrow that at 30 to 35 years there is a risk of 15%, and also we can see that at the age of 12 to 19 years the risk is 13%. Okay, 12 to 19 year, 13%, and at the age of 20 to 24 year this risk declines to 11%. Okay, so you can see that the lowest risk is at 20 to 24 years. Okay, this was also one exam question, that when is the lowest risk, and that is the age of 20 to 24 year. Okay, and when you go to the 25 to 29 years, slightly the risk increases to 12%. Okay, and at age 30 to 34 year, as the question is asked, 15% risk is there, and at age of 35 to 39 years we have 25% of the risk. At 40 to 44 year we have 51% of the risk, and more than 45 years we have 93% of risk. So the maximum risk is at the age of more than 45 year, when we have 93% risk. Okay, lowest risk is at the age of the 20 to 24 year, and highest risk is more than 45 year. Okay, and also study that advanced maternal age has also been identified as a risk factor for miscarriages. The risk factor for miscarriage is highest among the couple when the woman is more than 35 years of age and man is more than 40 years of age. So this point of the guideline is very important. Now, what is the answer of that question? Answer 1 is that of the 15%. Risk of the miscarriage at the age 30 to 35 years is that of the 15%, as you studied it. Okay, now coming to the second question, prevalence of chromosomal abnormalities in recurrent miscarriages. Okay, how much is the prevalence of chromosomal abnormalities in recurrent miscarriages? We have the different options like 10 to 15%, 20%, 30%, 32 to 50%, 30 to 57%. Okay, so how much is the prevalence of the chromosomal abnormality? We have to check that. Okay, so for that it will be better if you go to the guideline again. Okay, embryonic chromosomal abnormality 0.4.3.2 of the RCOG guideline. It is written that in a couple with recurrent miscarriages, chromosomal abnormality of the embryo account for 30 to 57% of further miscarriages. Okay, so chromosomal abnormality account for 30 to 57% of further miscarriages, and the risk of the miscarriages resulting from chromosomal abnormality of the embryo increases with advancing maternal age. Okay, so answer is that of the E. Prevalence of the chromosomal abnormality in recurrent miscarriages is 30 to 57%. That is the answer. Now, question number 3, primary gravidae, age more than 45, what is the highest risk of? Okay, she is at highest risk of what? Chromosomal abnormalities, congenital abnormalities, Down syndrome, and miscarriages. Okay, so at the age of more than 45, which risk is the highest? Okay, that is a very important question. Okay, so if we go to Dewhurst, we will find these tables. Okay, now coming to the risk of spontaneous miscarriages at age more than 45, we have 93% risk of miscarriages. Okay, and with regard to preeclampsia, we have 5.4% risk, gestational diabetes 7% risk. Okay, and at age 45 the risk of chromosomal abnormality is 1 in 18, and the risk of the Down syndrome is 1 in 25. You can see that the risk of Down syndrome is very high. 1 in 25 is the risk. So you can see that the highest risk is that of the spontaneous miscarriages, which was 93%. Okay, now coming to question number 4, recurrent miscarriages affect couples. How much percent of the couple is affected by the recurrent miscarriages? We have different options like 1%, 2%, 3%, and 5%. So the answer of that, we can check it from the guideline. And you can see from the guideline, it is written that recurrent miscarriages, defined as the loss of 3 or more consecutive pregnancies, affect 1% of the couple trying to conceive, and it has been estimated that 1 to 2% of the second trimester pregnancies miscarry before 24 weeks of gestation. So it's written clearly that 1% of the couple are affected by the recurrent miscarriages. So that is basically the answer of this question. Okay, recurrent miscarriages affect couple, how much percent? That is 1%. Okay, I will try to gather some more questions related to the different topics as well, and it would be better if you try to find out the answer of each questions by going to the book and trying to find out the specific references, because if you find the reference, that would be very helpful to you, not only in understanding the topic, but also for the confirmation of the answer of that specific MCQ. Okay, thank you so much for your patience. Allah Hafiz.